breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos, my co-host, Dr. Glenn Harrison. What's up, buddy?
I'm doing good. I'm doing great. How are you doing this evening?
Good. It was a little bit hard to get started. It was a little bit sluggish.
Were you feeling any dizziness or vertigo or anything?
A little fatigued.
Oh,
yeah.
Okay.
So today we are talking about something that we come across quite commonly in our clinics, and we get asked about very commonly, and that is anemia. There's various types of anemia. I think that there's a general maybe lack of understanding as far as what the complexities are of it. So we're going to go ahead and cover a lot of that stuff today. If this is your first time listening or watching, please hit like and subscribe, turn on notifications, because we're going to continue to roll out new content each and every week, and you never know when it'll be applicable to you. So without further ado, let's talk about anemia. So what is anemia? Anemia occurs when there's a deficiency in some sort of nutrient that causes deficiency of oxygenation in your blood. That's the low and dirty of it.
Yeah, that is the low and dirty of it. And this anemia, I think why it's so important is it's like the most important thing to determine in any lab panel, because of the organism cannot, if you're anemic, you can't transport oxygen, you can't uptake oxygen, and if you can't do that, there's no system in the body that won't be compromised. Every system in the body will be compromised. So it's like top tier. In fact, I'm going to be going in and talking to an anemia case here shortly, and it is severe. It's absolutely severe. It's fact. There's all sorts of other problems of the blood work that I know this individual wants to work on: diabetes and other deficiencies and digestive disorders and fatigue and being lethargic and the thyroid issues and adrenal issues. There's lots going on. I'm not worried about any of that. I'm worried about this anemia. So that's why it's so important.
Yeah. I mean, oxygen is the building block of everything. When we look at, like, when we make energy, it is exponentially more efficient. Our body is more efficient in the presence of oxygen. You look at the energy molecules, it goes from like 32 when you have the presence of oxygen to like 2 when you don't. So you can imagine how inefficient your body is when you are unable to transport oxygen around the tissues. So anemia is very, very important. It's one of the first things that I rule out when I have any sort of complex case, because if you don't take care of the anemia and figure out why it's happening in the first place, then you're not going to be able to resolve the other issue.
Nothing else matters, really.
Yeah.
So what are some symptoms that you'll see with anemia?
Yeah, so very commonly in my clinic, what I see, and I suspect anemia, or I absolutely want to rule out anemia first and foremost, is anytime I see anyone that has chronic fatigue, any sort of like dizziness, and especially dizziness when you've done a bunch of like testing to rule out any sort of like, vestibular issues or cerebellar issues or anything like that, or any sort of like, orthostatic issues, cardiac issues. If it's just not making sense, I always want to run blood work and make sure that there's no sort of anemia. You can have even things like brain fog or issues concentrating, or even, and you brought this one up because I think it was one of your patients we'd kind of discussed where like she had welts from like insect stings or something.
Yeah, bee farm. And we found anemia quite early because we ran some lab work, and it was missed. I'm not even going to say it wasn't found. We'll just say it was missed. And this lady was dealing with a lot of neurological focus, concentration issues for years. Once the anemia started to, we started to get her slowly out of anemia, she told me her bee welts went away. I knew nothing about bee welts on her body. And that was, I believe it was 7 to 12 years prior to our meeting.
That's crazy. So she just had these open kind of.
Well, they were like a welt. It wasn't open. It was almost like a scar.
It just kind of went away.
After they disappeared within a few months, couple months.
Yeah. And you can think even like things like slowed wound healing, if you were a diabetic or something and you were anemic and, then you increase the chances of infection, gangrene, all that kind of stuff. So, could definitely see how that would be a big issue for someone, even like a diabetic.
Yeah. So I always say, it's like if you cut your toe and you keep your socks on, that'll never heal very quickly. And even this individual, back to those those welts, they they existed for, again, 7 to 12 years. And that was just the effects of oxygen, getting oxygen in her blood. Her body was able to heal those tissues. Can you imagine every other tissue in the body? Like, it's unlimited of what oxygen deficiencies could do to someone's body.
Yeah, that's like rule number one when I'm dealing with any sort of like patient that has issues with concentration, or even when you find like neurotransmitter issues, like you got to make sure they're not anemic. So
Yeah.
very important. So how does it happen? What are some common causes of anemia? And these are by no means like comprehensive, but these are just the most common ones that we see. We're not saying these are the only ones, but these are the ones that we commonly see.
I think, yeah, that you framed it right. That some of the more common ones, there are some more complex issues, but one is, of course, the loss of blood, because that's where these resources are. I think the misconception when people think of anemia, they just think of iron. There's a lot more than iron deficiency anemia. There's B12, B9 deficiency anemias. Those are other common ones. It's not only iron. But if someone's losing blood loss due to heavy menstrual cycles or internal bleeding or wounds, sometimes just a GI bleed. If it's a slow trickle, you're not going to see it when you go to the bathroom, the toilet. You're not going to see blood in the stool. Well, hopefully, if you do, get to the emergency right away. But microscopic, find it in a test where they're actually analyzing the stool, looking for trace amounts of this. I've seen many anemic cases where there was no explanation for anemia. They're males. There was no menstrual cycle, of course. So I guess blood loss in one form or another. Another one is diet, especially with iron or B12. People that are avoiding certain foods, like vegans and vegetarians. That's non-heme iron, plant-based iron is hard to absorb. In fact, it's probably the most common cause of iron deficiency anemia in my clinic is plant-based diets, secondary to digestive disorders. They might have great, I shouldn't say, they might be eating the right food, but if they can't, iron's hard to absorb. And if you can't absorb it in your digestive tract, you have some digestive problems, there you go. There's anemia right there. And it's subtle. You don't know. There's these bizarre symptoms. And if the doctors tend to run the proper labs, and then you just suffer for a long, long time.
Yeah. I actually had a vegan that came in with like migraines, headaches, and all this type of stuff. And it was an iron deficiency anemia that was like really, really low. And it was from her diet and lack of absorption. The other thing that I commonly see is like inflammation, because you can get anemia associated with chronic inflammation.
That's right.
And that can be like a silent killer as well. Some other things would be like, genetic issues, autoimmunity. You can actually have autoimmunity to your red blood cells that can affect them as well. So some common causes that we see associated with anemia. So then that begs the question, how do I find out if I am anemic? Say you have, low energy, you're fatigued, you're getting dizzy when you stand up. What do I do? How do I figure it out? This is like one of my favorite tests to run because it's incredibly cheap and it can tell you so much if you sit down and actually look at it and break it down. And that's just running like a routine CBC, which looks at the size, shape, color, and distribution of the cells. And then it can tell you like, okay, this cell is too big or too small, which can help you like figure out what type of anemia it is. Oh, they're spread out. They're the wrong color. It can be an incredibly invaluable test, and it's so cheap.
That's right.
Everyone should just have it run.
Yeah, I think so. And it's usually run in a routine medical checkup, just CBC. But a lot of times, unless the patient has some severe symptoms and someone is anemic, it's dismissed.
Mm-hmm. Usually it's got to be like pretty significantly anemic before they're like, oh, wow, you're really anemic. Let's put you on iron. Which is great, but then it doesn't answer the question as to why are you iron deficient, or why are you
exactly.
anemic in the first place?
Is there a GI bleed, or you know, where is the source of blood loss, or lack of absorption, or lack of digestion, or so so anemia by definition, if you're doing a CBC and you have your, you know, you have your you're looking at your panel while you're watching or listening to this, you want to make sure that you don't have either low hemoglobin, low hematocrit, or low red blood cells. If any one of those are low, that's definition of anemia. But you don't have to have signs and symptoms of anemia. You don't have to be anemic to have any kind of symptoms. You can be borderline anemic, but if your body can't acclimate to the oxygen load, like I see here in Colorado, everything gets skewed because of our altitude. So our body has to make extra red blood cells, extra hemoglobin, and extra hematocrit just to be able to transport the limited amount of oxygen. So people can't tolerate, they have less of a tolerance here for lower iron or lower B12 or any of these things to get symptomatic of anemia, but on a lab, it doesn't quite look like anemia yet. Put them down to sea level and you'll see all those numbers drop, and there they are. Now they're diagnosed with anemia. And I get close to one case a week on that's anemic. That's why this podcast is so important. And people have been suffering for 10 to 30 years.
And it's because where they're at, right? So the higher the elevation, your body's going to naturally make more what's called erythropoietin, which is going to increase the amount of red blood cells you have, right?
It should,
yes. Yeah. And if you're anemic, like they might look, oh no, you're in the range. Well, you lower the atmosphere, then it's going to look like anemia.
Yeah, and high altitude is really where it starts to show up, and where the Achilles heel is exposed. It's like having a sore arm. I don't know. You might be able to throw the ball a few times, but if you really, really throw it a lot, that's when it starts to get achy.
Yep, you got it.
So it's just the weak link. So yeah, CBC is the easiest and the cheapest, and it should be ruled out all the time. So now, say someone's listening to this, they already have anemia. That's why they clicked on the link and they want to know more about it. What should they do? What are their strategies to get out of this disorder?
Yeah. So first off, you have to determine what type of anemia it is, because there is different types we just talked about. You know, you can have megaloblastic, you can have sideroblastic, you can have normochromic, normocytic. You don't care what type you have, but you need to find out or find someone to help you figure out what type of anemia you have. What's causing it, right? So if it is a nutrient deficiency, why are you deficient in that nutrient? Is it absorption? Is it you're not eating the right diet? Is it that you have a bleed somewhere? And then you can make the appropriate, you know, if it's diet, you can make dietary changes. If it's that, you know, you're having issues with absorption, you can look at addressing the gut health. If it's like a bleed, you're going to want to figure out where. If you're not a female and you don't have a heavy menstrual cycle, you're going to want to figure out, you know, do I have some sort of
fibroids,
uterine fibroids? Do I have some sort of like, you know, gastric ulcer or bleeding polyp or whatever it is?
Or do I have a bunch of autoimmune disorders and I have a lot of inflammatory responses in my body? There's a lot of other health issues. In fact, I just have one the other day. This individual, you know, there's so much inflammation. They're lit up like a Christmas tree. And I look at their labs and they're extremely anemic, extremely. And I'm like, you know, I asked, what did the doctor, you know, I always ask, what did they learn about their labs? And 99% of the time, no, the doctor didn't talk about this. I said, well, this means you're anemic. Did they ever use that word? No, I've heard of anemia. Yeah. And brain fog.
Kind of a big deal.
Yeah. Chronic fatigue, all sorts of depression and anxiety. I'm very confident once pain, because she's rheumatoid and all these other, once the pain lifts and she's getting oxygen to her brain and cutting down that inflammation, I'll see changes in her depression and anxiety. I'm almost guaranteed. I've seen it so many times. I know you have as well. So, that was a little bit of a tangent, but knowing the why of the problem, first knowing the type of anemia, and then hunting down from there, going in the direction of the cause of it, and not just accepting it, because this lady brought him back to her doctor. Said, I'm anemic, and the doctor said, yes, you're anemic. Well, what do we do? Well, there's really nothing we can do. That's what there's
a lot you can do. You got to figure out why you're anemic.
Yeah. You're literally suffocating, like you're at 16,000 feet above sea level, but you are at sea level and you're suffocating. You're existing your life at 15, 14, 16,000 feet above sea level. There's got to be something that can be done. So it's already turning. It's already changing for her slowly. But yeah, it should never be accepted ever.
No,
ever,
absolutely not, because oxygen is very important, like we talked about before.
Mm-hmm.
So
I don't know where else we can go with this when it comes to
I think we kind of summed it up really quickly, but I think efficiently, like if you have it, figure out why you have it, figure out what kind it is, and then implement some strategies. And if you can't do it on your own, find someone that'll help you.
That's right.
Don't dismiss it.
This is a little bit of a tangent. What are some risk factors maybe? We did talk about, blood loss. So females heavy, let's just try to summarize this. Heavy periods. Things that are obvious, people, heavy periods, and energy gets low and challenge, and then slowly almost builds up in the month and then back again, never quite feeling optimal. That could be a sign of anemia. Inability to tolerate high altitudes. So if they're anemic at sea level and they come up higher altitude, dizziness, vertigo. What are some other risk factors?
So obviously, like smoking would be one.
Yeah.
You could do smoking. If you're certain, like we talked about, vegans, vegetarians.
That's right.
Those are because you're not eating maybe the necessarily nutrients in the quantities that you need, or you're eating less absorbable forms.
Chronic digestive issues.
Chronic digestive
people
issues.
Who are on antacids, proton pump inhibitors, and any kind of antacids. Diagnosed with heartburn, indigestion, or GERD.
Yep.
Because that's shutting down the acid, compromising the ability.
Then you're not digesting it, you're not absorbing it, right? There's certain genetic factors that can play into anemia. You could look at, sickle cell. That's a different type of anemia. That's a genetic one. So there's a lot of different types. That's why it's important to figure out what you have, what risk factors you would have, and then find someone that's going to be well equipped to help you manage it.
That's right. And here's something not to do. If you think you're anemic and then you just go to the store and then just start taking a bunch of iron supplementation, I don't recommend that.
No, don't do that, because you can actually have like certain situations where the reason you have a blood loss is it's being stolen. Like it could be whatever it is, a fibroid or tumor,
malignancy.
whatever.
And if you add more iron and it hits your GI tract, as a lot of it passes through, you can make that problem worse. So
can grow. Yep. So don't just do that. Don't try to do it by yourself. Figure out why.
Just do the test and know for sure.
You got it.
Exactly.
So hopefully you guys got some value out of this. This is, again, something that we see really, really commonly and have questions on all the time. So we figured we'd put it in one place where everyone can find that information. And again, if this is your first time listening, please hit like and subscribe and turn on notifications, because we're going to continue to roll out content. If you'd like to contact us or find more information on the two of us in our podcast, you can contact us at info@brainstormingwiththedocs.com. My website is northlakeschiropractic.com. Dr. Glenn's is drgharrison.com. Those are both in the link. And shoot us any questions or comments, and we'll do our absolute best to get back to you. So
sounds good.
All right, buddy. Till next time.
Okay. I look forward to the next one.
All right. Bye.